Every year, 1 in 3 adults over 65 will experience a fall. For many of these individuals, weakened bones are the silent culprit. It's a harsh reality, but one that's all too common as we age. The bones, which once seemed so sturdy, gradually lose their strength, and fractures become a dangerous risk. And while we're all encouraged to take vitamins for our bone health, here's something surprising. Some of those very vitamins we trust may actually be doing more harm than good. Imagine being told you're doing something that's supposed to help, only to find out it's contributing to the very issue you're trying to prevent. It's unsettling, but that's exactly what we're going to explore today. If you've ever wondered whether the vitamins you've been taking for years are truly helping your bones, or if you've started to feel some discomfort or worry about bone strength, this video is for you. Today, we're focusing on 6 common vitamins and supplements that, despite their widespread use, may be weakening your bones. And to make matters more surprising, some of these are vitamins that you might already be taking, thinking they're the key to stronger bones. The importance of bone health after 60 can't be overstated. Osteoporosis, the thinning and weakening of bones, is a condition that affects millions of older adults, and it's often called a silent disease because it doesn't show any symptoms until a fracture occurs. The risk of fractures rises significantly as we age, and every fall or misstep becomes a potential catastrophe. But what if the very supplements you're taking to prevent these fractures are making things worse? By the end of this video, you'll know which 6 vitamins could be putting your bones at risk, and more importantly, what you can do about it. Some of these might surprise you. In fact, one of the most common vitamins that people believe is strengthening their bones could actually be weakening them. It's time to take a closer look at what's in your supplement cabinet and reassess whether these vitamins are truly working for you or against you. But before we get started, make sure to subscribe to the channel and turn on notifications so you don't miss more important tips on how to stay healthy as you age. If you've ever wondered about your current supplement routine, or if you've been questioning whether you're taking the right steps to protect your bones, keep watching. We'll uncover some essential insights that could make a real difference in how you approach your health moving forward. Let's get started. 1. Vitamin A. Vitamin A is a nutrient that many of us are familiar with, often associated with eye health, immune function, and even skin care. It's a common ingredient in multivitamins, and we typically think of it as something that's essential for our overall well-being. Foods like carrots and sweet potatoes are well known for their vitamin A content, and it's easy to see why we trust it as a key part of our health routine. But here's the issue. While vitamin A plays a crucial role in many bodily functions, taking it in excessive amounts, particularly through supplements, can have an unintended impact on your bones. When we consume too much vitamin A, especially in the form of supplements, it can interfere with calcium metabolism, an essential process for maintaining strong bones. Research has shown that high doses of vitamin A can reduce bone mineral density, which means your bones become more fragile over time. As a result, you may find yourself at a higher risk of fractures, even with minor falls or bumps. This is a serious concern for older adults, whose bones may already be more susceptible to breaking. Let's think about this in more relatable terms. You might have been taking vitamin A for years, trusting it was helping with your vision or boosting your immune system. It's not uncommon to hear, "It's good for your eyes." And you've probably seen the ads for multivitamins that promise better health overall. But over time, as you continue with high doses of vitamin A, the excess starts to take a toll on your bones. You may not notice it immediately, but the damage can slowly accumulate, leaving you more vulnerable to fractures than you might have anticipated. So, what can you do instead? First, consider getting vitamin A from natural food sources, like the beta-carotene found in vibrant fruits and vegetables such as carrots, sweet potatoes, and leafy greens. These foods provide the body with the vitamin A it needs without the risks associated with high doses from supplements. If you're concerned about your vitamin intake, choosing a multivitamin with lower levels of vitamin A is a safer option. And for bone health specifically, vitamin D3 is a much better alternative to help with calcium absorption and bone strength. Always remember, moderation is key. When it comes to vitamins, more isn't always better. 2. Vitamin D, high doses. Vitamin D is a cornerstone of bone health, as it plays a key role in helping your body absorb calcium, which is essential for maintaining strong bones. Many seniors take vitamin D supplements, especially for joint pain relief or as part of their osteoporosis prevention strategy. It's widely recommended for keeping bones healthy, and for good reason. Without enough vitamin D, calcium can't be effectively absorbed, which leads to weakened bones over time. However, like many things, balance is crucial. While vitamin D is undeniably important, taking it in excessive amounts can lead to serious issues, particularly when it comes to calcium balance in your body. Taking too much vitamin D, especially in the long term, can cause your blood calcium levels to rise too high, a condition known as hypercalcemia. This excessive calcium buildup in your blood can have a detrimental effect on your bones, actually weakening them rather than strengthening them. In addition to affecting bone density, high levels of vitamin D can also strain your kidneys, potentially leading to kidney problems over time. So, while vitamin D is beneficial, too much of it can backfire, causing more harm than good, particularly when it's not monitored carefully. Let's break this down with an example. You might be taking 2,000 IU of vitamin D every day, believing it's providing the extra support your bones need. You might even feel better or notice less joint pain, so it seems like the right move. However, research shows that over time, high doses like this can lead to too much calcium circulating in your bloodstream, and this can ultimately weaken your bones. If you're not also tracking your calcium levels or working with a healthcare provider to monitor the effects, you might be unknowingly making your bones more fragile. What's the safer path forward? The general recommendation for vitamin D intake is typically around 800 to 1,000 IU per day for seniors, though individual needs can vary. It's always wise to consult with your doctor before adjusting your dosage to ensure it's the right amount for you. Beyond supplements, you can also get vitamin D from natural sources like sunlight and foods such as fatty fish, fortified dairy products, and egg yolks. Sunlight exposure is especially important as your skin can produce vitamin D when it's exposed to sunlight. So take a moment to enjoy some fresh air outside. Your bones will thank you. 3. Vitamin E. Vitamin E is often praised for its antioxidant properties and is commonly taken to prevent heart disease and combat skin aging. Many seniors add it to their daily supplement regimen in the hopes of improving skin texture or protecting their hearts. But what they may not realize is that taking too much vitamin E can cause complications for bone health. Vitamin E is great for fighting oxidative stress in the body, but in large doses, it can interfere with the absorption and function of vitamin K, a crucial nutrient for both bone health and blood clotting. Vitamin K is essential for bone mineralization and helps your blood clot properly, both of which are vital for recovery after injuries or fractures. When there's too much vitamin E in the system, it can diminish the effectiveness of vitamin K, making it harder for your body to maintain strong bones or recover from fractures. Additionally, high doses of vitamin E can increase the risk of bleeding, which is especially concerning if you've suffered a fall or injury. The combination of impaired bone healing and increased bleeding risks can make even small fractures more dangerous. Imagine this scenario. You've been taking vitamin E to help with skin issues or to boost your heart health, but you may not realize that too much of it could be hindering your recovery from a fall. You might find that your bones don't heal as quickly or as effectively as they should, and the risk of further complications could rise. It's a situation that's all too easy to overlook if you're focused on the benefits of vitamin E for other aspects of your health. To avoid this, it's important to not exceed 400 IU of vitamin E per day, as higher doses have been linked to negative side effects. Instead, focus on getting vitamin E from natural food sources like nuts, seeds, and vegetable oils, which offer a balanced intake. When it comes to bone health, prioritize vitamin K-rich foods like leafy green vegetables, which help with bone strength and also promote healthy blood clotting. By managing your intake of these vitamins carefully, you can ensure that you're supporting your bones and overall health without causing unintended harm. 4. Calcium. Calcium is one of the most well-known nutrients when it comes to bone health. It's a key player in maintaining strong bones and preventing conditions like osteoporosis. Many seniors rely on calcium supplements to ensure they're getting enough of this vital mineral, often in the hopes of preserving bone density and preventing fractures. However, while calcium is essential, too much of it, especially if it's not paired with vitamin D, can actually do more harm than good. Excessive calcium intake, particularly from supplements, has been linked to a range of health issues. One of the most common problems associated with overconsumption is kidney stones, which occur when calcium builds up in the kidneys and forms hard deposits. In addition to kidney stones, excessive calcium can also lead to vascular calcification, where calcium builds up in the soft tissues, including blood vessels. This not only affects the health of your bones, but can also increase the risk of heart disease and other complications. Consider this scenario. Let's say you've been taking 1,500 milligrams of calcium every day for years, believing it's the best way to protect your bones. But what you may not know is that research shows too much calcium, especially when you're not getting enough vitamin D to help with absorption, can actually weaken your bones. Over time, it may lead to kidney stones and can even cause calcium to deposit in areas where it shouldn't be, further contributing to bone problems. Instead of relying on supplements, it's far safer to get your calcium from food sources like dairy products, leafy greens, and fortified plant-based options. These foods provide a natural balance of calcium and other nutrients that support bone health. If you're considering calcium supplements, it's important to first check your calcium levels with a healthcare provider to ensure you're not exceeding the recommended amount. A balanced diet, combined with regular sun exposure for vitamin D, is often the best way to support your bones without putting them at risk. 5. Iron. Iron is a vital mineral for maintaining healthy blood, particularly in preventing anemia and boosting energy levels. Many seniors take iron supplements to combat fatigue and improve overall vitality, especially if they've been diagnosed with low iron levels. Iron plays a critical role in carrying oxygen through your blood, so it's no surprise that it's a common addition to many supplement routines. However, while iron is necessary for good health, too much of it can interfere with other essential nutrients, particularly calcium, and can have long-term effects on bone strength. excessive iron in the body can reduce calcium absorption, which is crucial for maintaining healthy bones. In addition to interfering with calcium, high iron levels contribute to oxidative stress, which can damage bone cells and lead to a gradual loss of bone density. This type of oxidative damage can weaken bones over time, increasing the risk of fractures and impairing overall bone health. So, while iron supplements may help with energy levels, too much can be a double-edged sword when it comes to your bones. Imagine you've been taking iron supplements regularly, perhaps because you've been feeling fatigued or just want to ensure you're getting enough of this essential mineral. You've been told that it'll boost your energy and overall health, but what you might not realize is that over time, excess iron could be doing more harm than good. As your iron levels build up, they could be interfering with your body's ability to absorb calcium, gradually weakening your bones. The result is that you might find yourself more susceptible to fractures, despite the energy boost you initially experienced. If you're considering iron supplementation, it's important to do so only when necessary, based on blood tests or a doctor's recommendation. Iron deficiency can certainly lead to fatigue, but it's also important not to take more than what your body truly needs. Instead of relying on supplements, try getting iron from natural food sources such as beans, spinach, lean meats, and fortified cereals. These foods provide iron in a more balanced form, with other nutrients that can support overall health without the risks associated with excess iron. And as always, before starting or adjusting any supplement regimen, consulting with a healthcare provider is key to ensuring you're making the right choice for your bones and overall well-being. 6. Magnesium low levels. Magnesium is an essential mineral that plays a significant role in bone formation and health. It's commonly used by seniors to prevent muscle cramps or spasms, as it helps relax muscles and maintain normal muscle function. Magnesium also plays a crucial role in regulating calcium in the body, which is key to maintaining strong bones. However, despite its importance, many seniors may not be getting enough magnesium through their diet, which can lead to bone-related issues over time. When magnesium levels are low, it can interfere with calcium regulation, increasing the risk of reduced bone mineral density and fractures. Magnesium helps to maintain proper calcium balance, and without it, bones can become more fragile and susceptible to breaks. Studies have shown that a deficiency in magnesium can directly impair bone strength, making it harder for bones to resist the natural wear and tear of aging. So, while magnesium is important for muscle function, its role in bone health is just as critical, and insufficient levels can contribute to bone problems. Imagine this. You're taking magnesium supplements to relieve muscle cramps, thinking you're doing your body a favor. But what you might not know is that insufficient magnesium in your system could be making your bones more vulnerable to fractures. Despite feeling better in terms of muscle cramps, the lack of magnesium might leave your bones weaker over time. It's a perfect example of how one deficiency can affect more than one aspect of your health, and how addressing magnesium levels is crucial for not just muscle health, but for bone health too. To make sure you're getting enough magnesium, try to incorporate magnesium-rich foods into your diet, such as almonds, seeds, and whole grains. These foods are not only beneficial for muscle function, but also help support healthy bones. If you find you still need a supplement, it's important to consult a healthcare provider to determine the correct dosage for your needs. Balancing magnesium levels through both diet and supplements, when necessary, can help improve your bone health and reduce the risk of fractures. The key takeaway is that not all supplements are as beneficial as they seem, especially when taken in excess or without proper guidance. Just because a vitamin or supplement is marketed for bone health doesn't mean it's always the best choice for you, especially as you age. Your body's needs change over time, and certain vitamins and minerals can have unintended side effects that you may not be aware of. It's crucial to stay informed about the potential risks of supplements and adjust your intake based on your personal health profile. Before making any significant changes to your supplement routine, it's always a good idea to consult with a healthcare provider. A professional can help you determine the right dosages, assess your individual health needs, and ensure that the vitamins and supplements you're taking are actually benefiting your bones rather than causing harm. It's also important to remember that supplements should never replace a balanced diet, which provides a more natural and holistic approach to maintaining bone health. By staying informed and being proactive about your health, you can ensure that your bone health remains strong, safe, and supported by the right vitamins in the right amounts. Adjusting your supplement routine based on your individual needs, rather than relying on one-size-fits-all recommendations, will help you make smarter, more informed choices about your health as you age. If you found this video helpful, please give it a like and share it with others who could benefit from this information. We all know someone who might be unknowingly taking a supplement that could be harming their bones, and sharing this video could help them make more informed choices. I'd love to hear your thoughts on this. Did any of these vitamins surprise you? Will you be revisiting your supplement routine after learning about the potential risks? Drop a comment below and share your experience with us. It's important to start a conversation about how we can all better care for our health as we age. If you haven't already, make sure to subscribe and turn on notifications so you don't miss out on more senior health tips that can help you live your healthiest life. We've got more essential advice coming your way to help you stay informed and empowered in your health journey. Remember, your bones are the foundation of your body, and it's never too late to start making choices that keep them strong and healthy. Together, we can navigate these choices in a way that's smart, safe, and informed. Thank you for watching, and I'll see you in the next video.